little bit on the Midwest and the state of Ohio and look a little bit at what some of those specific health impacts might be. I want to start looking at this image that comes from a U.S. Global Change Research Program recent report, and any of those of you who are interested, we can talk after the presentation or during, and I'll be happy to turn you on to any of these sources. An interesting map of the U.S. at night. We can see in the Midwest, and we can see the state of Ohio, the very bright light of Columbus, Ohio, where we are now, a bright spot in the state of Ohio. It's interesting that the temperature increase in the last 50 years that Dr. Hess mentioned has actually been running ahead of the global average temperature increase. The U.S. in that time has seen about 2 degrees Fahrenheit increase in temperature, which has been called unequivocally a temperature increase and due largely to the impact of human beings like ourselves in emitting greenhouse gases. Now, if we continue unabated producing greenhouse gas emissions as we are on track to now without some type of reduction legislation, some type of significant effort, by the end of the century, we will be, the concentrations in the atmosphere will be 2 to 3 times higher than they have been in the last 800,000 years. The cause for concern there is that in that time there have never been over 6 billion human beings like ourselves, also placing demands for food, water, sustenance on the ecosystems of the world. So, of course, there's a whole host of health issues, societal issues, environmental issues attendant with those sort of concerns. And I just want to show you here some of the health impact areas that I've been working on with my colleagues at NRDC, and in fact the whole research community of health scientists that are working in these areas. But these are some of the particular areas we've been looking at in the last 2 or 3 years. And I'll talk with you a little bit about this work as it bears on Ohio. Heat stress, certainly, as Dr. Hess mentioned. Air pollution, which I know a number of you work specifically in air pollution areas here in Ohio, and some of the cities in Ohio already have certainly air pollution issues, especially in summertime, and that can very much affect people with asthma and allergies, infectious diseases, which were mentioned previously, and extreme weather events, because climate change does in so many ways affect hydrologic cycle, and temperature increases affect the hydrologic cycle as well. Let me just mention some of the observed changes in the environment in the past years in the Midwest. Again, that Midwest region that I showed you on the U.S. map. In the last 50 or so years, there has already been an increase in the amount of very heavy precipitation that falls in the most extreme rainfall events. A 31% increase in that amount of rainfall that comes down in the most extreme, sort of the most extreme 1% of rainfall events. That can have impacts not only in terms of increased flooding, but also in an increased tendency towards these waterborne illness events as pathogens are washed over land and potentially into drinking water supplies. There have been warmer temperatures in that time that have been seen over the U.S., in particular in the Midwest, and also the timing of snow melt, of when precipitation is falling, is already being altered. It's not to the advantage of agriculturalists or the human population to get more precipitation in winter and spring and less in summer, but that's exactly what we're seeing and what is projected to increase as global warming continues. Just want to touch on some of the future trends that are being projected in the Midwest and the state of Ohio. These are a series of maps. The 4 panels are detailing some of the temperature projections in the Midwest, and of course you can see Ohio in the right center, a little bit below center, within these frames. The top row is showing that about a 3 to 5 degree Fahrenheit warmer temperatures are projected in the next 20 essentially years across the state of Ohio. The left column is under a lower emission sort of future projections. The rightmost column is a higher emission future if we as a society do less to limit greenhouse gas emissions. The way to read these is to see the redder colors as hotter emissions relative to sort of baseline temperatures, that is, from 1961 to the 1990s. So the redder see up to 14 degrees Fahrenheit average temperature increase. That's just the average. That's not speaking to the most extreme. That's not speaking to heat waves. It's been projected that in the city of Cincinnati by the 2080s, there could be as many as 85 days over 90 degrees Fahrenheit. That's almost 3 months. That's almost an entire summer above 90 degrees Fahrenheit. The same set of model projections are suggesting that over 30 days could be above 100 degrees Fahrenheit. These are rather significant changes with, of course, a lot of attendant health effects. Heat stress, the elderly, children, people who cannot afford to operate air conditioning, people living in the urban core of cities, in the urban heat island areas would be some of those most vulnerable to these effects. Poor air quality, ozone, ground level ozone smog is also affected by higher temperatures, and I'll talk about that in a moment. Some of the increasing extreme rainfall events will bear on waterborne illnesses, and Mike McNutt will talk about that a little bit later on. Also, there's a relationship between warmer temperatures and increased incidence of foodborne illnesses that has already been found currently, and that's being projected to increase in the future with higher temperatures. And as Dr. Hess mentioned, there are an expansion of the range of these insects, ticks, certain mosquito species that can spread vector-borne illnesses both northward as temperatures increase. Those vectors can also live longer into the winter seasons as temperatures increase. So there's an expansion of the seasons in which disease transmission is possible as temperatures continue to increase. As many of you know, I'm sure, ground level ozone is not emitted directly from smokestacks and tailpipes, rather. It's formed in the atmosphere from so-called precursor emissions, volatile organic compounds and nitrogen oxides in the presence of sunlight. And the higher temperatures are, the faster that reaction chemistry proceeds. And that's the connection with global warming. Higher temperatures tend to increase ground level ozone smog concentrations, absent other changes in those precursor emissions. Several cities in Ohio already have ozone smog health issues: Columbus, Cleveland, Cincinnati. Cincinnati has been, in a recent American Lung Association study, has been found within one of the 15 cities in the U.S. with a long-standing ozone smog problem. One study that looked ahead to the 2050s under a changing climate found that increasing temperatures could indeed increase the number of these ozone exceedance days in future under a changing climate. For Columbus, 11 more of these unhealthy smog days, these ozone exceedance days, in a typical summer were projected by 2050. A 28% decline in the healthy days in a typical summer under those conditions. For Cleveland, again, 11 more of these unhealthy air days, and for Cincinnati, 1 more, 12 additional unhealthy air days by the 2050s. The map on the right gives a sense of where Ohio is in the overall eastern U.S. And again, the redder colors signify a greater increase in ozone, ground level ozone concentrations by the 2020s in that case, which is a near term, and a relatively short term increase from now under a changing climate. There's another link between changing climate and atmospheric conditions, air pollution that bears on health, and that's a link with pollen. Dr. Hess mentioned this. The higher the ozone, or rather the carbon dioxide concentrations, the higher pollen production tends to be in some important allergenic plant species. Ragweed notably is one of those. And unfortunately, in many parts of the U.S., including Ohio, late summer is when ragweed produces its pollen. It also tends to be when there can be high ozone smog days. This is a map that NRDC prepared of the U.S. and those areas by county in which both ragweed occurs and